Hi, this is Dr. Jeffrey Lieberman with another Shrink Short. Now, psychiatry has the dubious distinction of being the only medical specialty with an anti-movement. There's no anti-cardiology movement. There's no anti-obstetrics and gynecology movement. There's no anti-neurology movement. But there's a virulent anti-psychiatry movement which persists to this day. Now, this movement started in the 1950s and was well-intended and pursuing an initiative of mental health reform that was due to the squalid conditions in state mental hospitals and the abusive treatment that the inmates received. But decades later, it has turned into an ideologically driven, dogmatic organization that tries to discredit the field of psychiatry and mental health care and discourage people from seeking treatment for what are evidence-based treatments and suffering from their illnesses in the absence of that. Now, ultimately, this is going to be self-defeating and destructive to society and needs to be stopped. But instead of stopping it, what's happened is a new alliance, Unholy Alliance, between the anti-psychiatry movements like MAHA in America and the MAHA movement, Make America Healthy Again movement, whose prophet is none other than the Health and Human Services Secretary, Robert F. Kennedy. Now, this bizarre term is really the height of irony, because no question that what we need is comprehensive mental health care reform. However, this is not the form in which it needs to take or which is going to accomplish the needed changes. To sum up, I'm desperately in favor of mental health care reform, but not in the way this self-appointed group, with the endorsement of our Health and Human Services Secretary, is preaching. In the past, well-intended efforts in mental health care reform have started out with good intentions, but have resulted in one step forward and two steps back. In this iteration, if this should go forward, it's going to be no steps forward and 10 steps back. We have to stop this and use the momentum of any attention that's been brought to bear on this much-needed initiative and have it driven forward with the right people and the right plan in place. This is Dr. Jeffrey Lieberman, and this has been another Shrink Short.